Thank you all for being here today. I'm excited to kick off the work of the Ways and Means Health Subcommittee for the 118th Congress with today's hearing about unaffordability of health care in America. 13 years ago, the former President Obama signed the largest regulatory overhaul and expansion of federal health coverage since 1965. At that time, President Obama and the congressional Democrats made a lot of promises to lead up to passage and signage of Obamacare. Then Vice President claimed it was a big deal. Unfortunately, he was right. It has accelerated health care costs faster at any point in the last 50 years and created an unworkable federal bureaucracy and took away control from patients and doctors. Luckily, since then, congressional Republicans and President Trump worked to undo some of the damage the bill created, repealing the disastrous individual mandate, repealing the Cadillac tax, repealing the Independent Payment Advisory Board, so our seniors can keep access to their care. Since 2010, however, the congressional Democrats and now President Biden have done everything they can to artificially prop up the Obamacare exchanges. The Congressional Budget Office's initial estimate for enrollment was off by 1/3, yet the Democrats continue down this road, called it a success. The only time enrollment has come close to the original projection was the Democrats spent billions of dollars to make coverage essentially free for anyone making up to $90,000 a year. In the spring of 2021, the American Rescue Plan included generous subsidies, convinced people to sign up for Obamacare plans while the number of enrollees increased. Those subsidies caused health care spending and inflation to go further in terms of inflation. They doubled down last year in the Inflation Reduction Act, which has instead continued fueling our current level of inflation by extending those federal subsidies for 2025. If Obamacare coverage is what people wanted, then why do they feel like they needed to bribe them to get them involved? Instead of just throwing more federal dollars at the problem, we need to come up with real reforms to our national health care system, both delivery and coverage of care, and put patients and doctors back in charge of decision-making, not the federal bureaucrats. Rather than government telling patients what they need, we must continue our work to help constituents get the right coverage for their family. For example, Republicans have promoted the use of associated health plans for small businesses so they can buy at a better rate and provide coverage to their employees. We've also returned the definition of short-term limited duration insurance plans to what it was before President Obama changed at the end of his administration. While there's no simple answer to bringing down the ballooning cost of health care in America, increasing competition, reducing government meddling, and putting patients and doctors back in charge is a good place to start. I worked with my Republican colleague on Speaker McCarthy's Healthy Task Force in terms of health care to come up with a patient-centered vision of how to reduce government involvement in medical decisions. The hearing is the first step to implementing many of those changes. The task force spent over 18 months meeting and numerous stakeholders, providers, patient groups, and others in the healthcare sector to gather recommendations on how to address the high cost of healthcare. I know in my district, in the last 8 years, it's gone up 75% in Florida. Congressional Democrats negotiated Obamacare behind closed doors. I introduced a resolution to require the negotiation takes place under the watchful eye of the American public. When then Nancy Pelosi pushed through the $1.2 trillion bill and cut a lot of different secret deals, so to speak. House Republicans, on the other hand, have worked to address the shortcomings of our nation's health care system through open discussion with various people in Congress so they can weigh in, as well as our constituents. We are on an unsustainable path of health care spending with over $4.3 trillion spent in 2021, accounting for nearly 20% of our GDP. It's at long last to work. We need to work together and find a way to rein in the spending and make sure we deliver for our constituents.